Our next guest warns you cannot, in fact, vaccinate a population out of an active pandemic. David Nabarro is the special envoy on COVID-19 for the WHO, and he joins me now. Dr. Nabarro, good to see you. Many countries, including the United States, Israel, much of Europe, now see boosters as the way out of this pandemic. And you know, they're backed up by people like Dr. Anthony Fauci here in the United States, who's now saying that, look, the booster, so that means 3 shots, is not a luxury. It's not an add-on, but it should be the standard. Is the WHO really contesting that at this point?
No, we are absolutely not contesting the important role of vaccines. They are fantastic at preventing people who get COVID and who then are at risk of being severely ill and then dying from actually perishing as a result of the virus. You see, they have an incredibly good success at reducing what we say mortality as a result of infection. But they don't stop infection. Infection still takes place, and people who've been vaccinated can still pass the virus on. But the important thing is they don't die. So what we're saying is, could we get vaccines to everybody who's at risk of death, particularly health workers, older people and people with diabetes, heart disease and other conditions? Because to use vaccines to try to reduce the circulation of virus in a population is not desirable. It's not going to work on its own. You have to do a much wider strategy.
But does that mean that countries like Israel and the United States and maybe even countries in Europe now are getting it wrong to distribute those boosters to everyone over the age of 18?
We don't fully understand the rationale. You see, the risks to younger people with this virus are much lower in terms of death. You do get a condition called long COVID, about 1 in 20 get it, which is really unpleasant. But we're not seeing high rates of death among young people. And as far as we understand, vaccination, particularly of large numbers of people, is not in itself going to reduce the amount of virus that is circulating in the population. The only way you can do that is by wearing masks and maintaining physical distance and being very careful when there is an outbreak to reduce movement into and out of the outbreak area. And so that's what you need to do to really reduce this pandemic. You use the vaccines to stop people who are at risk from dying. And we say there's plenty of vaccine in the world to make sure that everybody who's at risk of death can get it. And then if there's vaccine left over, we can start looking at other uses of it. But we really do not believe that vaccination on its own will end this pandemic.
And your advice to the countries like the United States would be stop the booster rollout to younger populations?
Postpone it. You're going to have to do boosters at some point. Of course, we know that immunization against COVID does not confer long protection, but we're saying, could you just postpone your rollout of boosters, perhaps by a couple of months, and then all the production that happens in that interval should go to the international scheme to get vaccines to the poorer countries where people are dying because they're working as health workers or they're older and they've got other diseases. They're dying and they shouldn't have to die because their deaths could be prevented through vaccination.
Yeah, as you well know, this country, at least in the United States, will be going in the opposite direction likely in the coming days. I want to ask you about something else, though. This looming concern is the emergence of new variants, right, that could evade the vaccines altogether. Is there anything there that you see so far that worries you? And do you believe that actually these antiviral therapies, after you test positive, is more likely to finally get us out of this pandemic?
Well, certainly there is a lot of hope with the new therapies that are coming on stream. And I'm very pleased to see that some of the companies that are manufacturing these therapies have committed to making them available in poor countries at a very low cost. This is extremely good news and a really welcome sign, because there's no doubt that having an effective therapy will make an awful lot of difference to the to the outcome of infection, particularly among poorer populations. Now, about variants, we do know that this virus is capable of mutating, and we've already got a number of variants that are concerning. Everybody, I think, probably knows about the Delta variant, which has taken over from the original virus in many countries because it spreads more easily. Right now, we do not believe that any of the variants that have appeared is somehow able to avoid the protection that's offered by the vaccines that are presently being used. But at the same time, there are signs that the virus could mutate in a way that would enable it to deceive people who've been vaccinated and actually get past the antibodies and cause difficulty. We know this is a possibility, and that's why we're saying to everybody, don't rely on vaccines alone for dealing with the problem of COVID. Please try to maintain the precautions that we know work: face masks, physical distancing, and being extremely careful in confined spaces. This virus has not gone away. We don't know very much about it, but what we do know is that it's capable of coming and causing trouble when we least expect it. So please treat it with respect.
Dr. Nabarro, we will leave it there, and I thank you for clarifying the WHO's position tonight. Appreciate it.